So we have here at the moment 5 panelists. Olli and myself will moderate the panel discussion. So thank you all for joining now. So we have Juha, Gabriele, Helka-Liisa, Kalle, and Hanna at the moment. And we will start with an easy question first. So the first question for the panelists is that please briefly introduce yourself by name, profession, institute, and country. Juha, please, Juha.
Okay, so hello, Juha Pajula from VTT Finland, Tampere, also as the university people are. I'm a senior scientist working mostly on the computer science and data analytics, as well as infrastructural design for data analytics. And the team where I'm working is focusing on health data analytics. So I'm doing 2 things in the project. It is infrastructure design, as I already presented, and then also some sort of data analytics and data visualization. Those are my roles. So I have no clinical background whatsoever.
Thank you, Juha. Kalle is next.
Thank you, Jutta. So I'm Kalle Kurppa. I'm originally pediatrician, and I'm working as a professor of pediatrics and also as a professor of promotion of the health of children and adolescents in the Tampere University and Tampere University Hospital. And we have the celiac disease research center here. So I have been studying mostly celiac disease and also type 1 diabetes, together with Heikki and the others. And I'm a member of the Deep Study Steering Committee, and that was about it, I think.
Thank you, Kalle. Then Hanna.
Good afternoon, everybody. My name is Hanna Haveri. I'm a clinical neurologist. I'm working in a central hospital in Lahti City, Finland. I have also researcher's background. I'm a visiting scholar at the moment in the University of Helsinki. I originally did my PhD in gastrointestinal diseases, and still nowadays I'm very interested in microbiome and environmental biodiversity and its effects in human health and especially brain health. I'm also a planetary health physician working in the Wellbeing County, and I attend the regional environment and health program Nature Step to Health. Thank you.
Thank you, Hanna.
Yes, hello everyone. I'm so happy to have a chance to be here. I am Tiina Vitikainen. I'm a nature and environment health specialist, and I work in Finnish Allergy, Skin and Asthma Federation, and in its research and communication unit, the Nature Health Competence Center. And my work is based on researched knowledge about nature health, that is, the well-being and health benefits we get from nature. And also in my work is very important to promote nature health by applying knowledge into action.
Hello everybody, and greetings from University of Oulu and Oulu School of Architecture, where I do work as a professor of urban design and planning actually since 2003, so 22 years. And my area of expertise is strategic, sustainable and interactive land use planning, and especially regarding the designing and planning of urban environments for health and well-being. I'm also a registered urban planner with many years of practical planning experience. Nice to be in this panel.
My name is Gabriele Berg, and I'm at Graz University of Technology in Austria, and leading the Institute for Environmental Microbiology.
From your point of view, why is exposome research important for policy? And then there's also a follow-up question. What is the single most striking exposomic insight that is ready to inform policy today?
So I think it's talking about policy. So I think not only for health policy this is important, it's also important for urban planning policies. In recent years, the research, so exposome research, has shown interesting results of the environmental factors that can also promote health. And it has increased understanding of the factors that can help planners to design better urban spaces, reduce disease prevalence, and in the long run also reduce healthcare costs. And then what comes to the follow-up question, there are many things, but I mention actually two. So in my opinion, the most striking exposomic insight to inform urban planning today are the insights that early life exposure to quality green spaces significantly reduces risks of immune-mediated diseases like asthma and allergies. And this insight calls for policies that integrate extensive and biodiverse green infrastructures into urban development, for example, to school and kindergarten yards. And my second point, well, it's connected to this, but somehow it's also a point of itself. So this requires unlearning among planners, since for a long time it has been thought that a good living environment includes easy to maintain paved play areas and well-maintained green areas with shortcut lawns. But now we know that biodiversity and certain wilderness and even contact with rotten wood is and can be good for health. So we, as planners, we do not only learn new things, but we need to unlearn certain old conventions in urban planning and urban design.
Thanks, Helka-Liisa. This resonates a lot of things that I have learned and studied in HEDIMED. So Tiina then continues.
Yes, well, I think, thank you. Yes, I think that exposome research provides information that the protective factors derived from nature are of great importance to human well-being and health. And this is very much in line with my organization's perspective. According to it, the nature health, that is increasing contact with nature, brings increased quality of life, as well as curbs down social and healthcare costs. The basic idea that the well-being of humans and nature is intertwined also guides us to take care of nature, thus tackling the environmental challenges of biodiversity loss and climate change. And as for informing policy, I think the main point is that because diverse nature plays such a large role in preventing and alleviating diseases, we need to increase our contact with nature in our everyday lives. The task of decision makers is to create and secure environments that promote both immune resistance and other well-being and health benefits from nature. Decisions are needed at various levels of society. And Helka-Liisa mentioned urban planning, and I might add, for example, social and healthcare practices.
I think the most striking exposome theory that has come out during the past decades has been the biodiversity hypothesis, and it combines nicely human health and biodiversity together. And I think the three crises of our time, they are global health crisis and the crisis with the loss of biodiversity and also climate change. They are all binded together. And I think the most striking is that we're still losing diverse nature around us, also in our living environments. And that's something that has to be done. And if I think about myself as a professional in healthcare, we have only 10% window to the health of an individual. So we have larger components in our determinants of our health is in the living environments, and that's what directs and modifies our behavior. And also during the childhood, it's the most important factor in what kind of living environments we're living in. So I think we have to take into consideration what kind of environment environment we have around us all the time. And as World Health Organization has postulated that every human being should have a green area at maximum 300 meters distance of one's home. So that is something we should have all our policies based on all the time. So biodiversity, that's the main question.
I think the previous speakers have quite nicely explained those same things. I was mostly thinking at the general level that I fully agree that as we have heard today, there has been a major increase in the prevalence of allergies and immune-mediated diseases, including type 1 and celiac disease during the past decades. Maybe there seems to be some sort of plateau, but at least in celiac disease it might still be increasing. So it means that these conditions have become a major global health problem. And as you said, it has to be something to do with environment, and as it has been said, there is evidence for that. If I think about the celiac disease, which I've been studying the most, there's still quite limited evidence. We know that viruses such as enterovirus virus, like in type 1, could increase the risk for celiac disease, and maybe the amount of certain dietary cereals that contain so-called gluten and so on. So we really need more evidence before we can be sure that these and some other environmental factors are really causing the increase. But there has to be something, because like we have heard, this increase is so steep. I think one important point is also that at least with celiac disease, we have learned that there are certain important things which do not increase the risk, including lack of breastfeeding and cesarean section, because these were previously thought that breastfeeding would be protective, and cesarean section is like increasing the risk. And I think it is important that we have already shown that they do not increase the risk, because often this causes guilty feelings in the mothers and so on. So we also have to learn what factors do not associate with the risk, and maybe what factors are protective and what increase the risk. But anyhow, I feel that we are really having now this kind of paradigm shift, that we are really trying to understand what causes these conditions and how we can really prevent them, and not just thinking secondary, tertiary prevention and treatment. So we are living really interesting times, I would say.
I have no clinical background, as I said, so my view is a bit different. I was last week on the Human Exposome Moonshot Forum, which was aiming to create a scientific initiative for global human exposomic research. It's very initial, but the view, in a way, I think that resonates very well for this question. So why the exposome is important for policy? Because I think it's because it bounds to most of the policies one way or another. So it is about the environment, the environmental factors, pollution, how much we allow that, what kind of materials we are allowed to use, what we should use, what we should not. And then what I think that we should take, because I'm the guy who is building up the environments and would like to get all the possible data in one place. Our team is looking very often at decision support tools for clinicians or other specialists. So one challenge what I see in exposomic research at the moment is that we need to have policy which enables us to have the data. We need to build these decision support tools, what is needed to analyze these problems, find the new connections and so on. So we should take that into account on these kind of data protection policies and others. It don't affect directly to people's health or environmental health, but without that we cannot affect the people's health and environmental health. So in a way that's my story, but I see that it's extremely important for any policies, because it affects to everything. It is everything. We cannot take it for one piece. But there is plenty of little pieces which can be connected to each other and look one part of the exposome, but the human exposome is huge.
The HEDIMED project was really very important for us. The cooperation within the different groups. And what we discovered was the link from soil to our gut via the microbiome. So, and this was a missing link before our project. I mean, there are several sentences like you are what you eat and so on. But now we really could figure out during the project that soil health is very crucial. The microbes from soil via the plants and the edible plants, then they can reach our gut system and increase or decrease biodiversity. And this is linked then to all the diseases we are speaking about. And so there is also a very important window of opportunity during first year of life to eat fruits and vegetables of good quality. So it's another criterion. So we all know that fruits and vegetables are healthy, but the microbiome was not considered. And this was something which we brought on the table together in the HEDIMED project. And this is very important political message also. What we need is really food of high quality for our gut health and for human health. And in the same extent, it's also crucial for planetary health, because if we shift to a more plant-based diet, then it would help planetary health as well. So, and I think this is the main message coming out from the project for us.
Next question for the panelists. So actually we can continue, Gabi, with you. So this question is directed for you only. Your research connects the environment and human health. So which area, like city planning, farming, or protecting nature, do you think could make the biggest impact quickly in applying your findings? So what's your opinion on this one?
Yeah, I think all kind of biodiversity in interventions in the urban area would be fantastic. So increasing the number of plant species. I mean, therefore you have to know that plants are really crucial in the whole system, because they have a long evolutionary time to develop, and they are the provider really of microbial diversity to us and to our urban cities. So therefore it's very important also inside of the flats to have house plants, but also, and maybe even eatable plants, and outside. So all this kind of research, what also Aki is doing, I think, is really of importance. And the plant diversity is really crucial. Also changing playgrounds, changing the built environments to open windows. So it's very simple. We could immediately realize to do, because at the moment it's more the opposite. I mean, these are these houses which have no connection to nature anymore. You cannot open the window. You have also the inner circulating air condition. So all that is not really healthy. Urban agriculture would be also, or horticulture would be also fantastic. So for the kindergarten, use natural soils, use berry shrubs and edible plants to plant them.
Thank you. That's very interesting. And I was thinking just on top of my head now, mentioning the diversity of the plants and all that. Do you know, does anybody know if there are any like specific plants that would be good for your health? Or is it just a diversity in general?
It's just diversity, because they are all different. So, and this makes them so important.
Thank you. And then what do you, Gabi, think? Is there any specific measure that regulators should use to make decisions in this regard? So what you just mentioned, that what do you have any opinion what they should do? Any measures to help them to make decisions, like the biodiversity score, for example?
Yes, and I mean the microbiome is also a very good tool or indicator. The diversity of the microbiome. So what we see is a decrease of microbial diversity in our gut system. So we lost already half of the diversity, and also the environmental microbiome is shrinking. So it could be an indicator, the microbial biodiversity in general. Maybe we also could have a look on specific biomarkers.
Kalle, clinicians see the effects of policies in the everyday life and work. In your opinion, what would help pediatricians include exposome factors such as early exposure to microbes or diet recommendations in the preventive care guidelines?
Well, obviously, science and more research would help us in this sense. So I think we are already incorporating many these aspects in the guidelines for treatment and especially prevention of allergies. And we are learning all the time more and more. Although, like I say, we still need more evidence because these guidelines are quite evidence-based, and we have this kind of grading of evidence, so we have to be careful before we say that, even though it seems quite obvious that increase in, for example, biodiversity would reduce the risk for most of these conditions, but we need quite strong evidence before we can say it directly in the guidelines. So we still need more research, more EU money, and more other grants and so on, high quality research. But at this point already we obviously try to think that what could be beneficial for the children in general, what is not harmful, and what is likely could prevent these conditions. So we are thinking this kind of positive way as we are planning these guidelines. When I'm talking, for example, with patients, of course I have to be a little bit cautious before I say something that you should use more of this or more of that. So that is always a tricky question. What can I say? Like I said, I think we are learning fast and learning new things, and what the previous speakers have said about what is healthy environment, I fully agree with that. And I think that is something we can definitely say, that you should spend more time in the nature, you should have more biodiversity in your diet, because that is so beneficial in many different ways. This is what I think.
So we had a follow-up question that do we now have enough solid evidence to support, for example, paying for nature prescriptions, so that doctors should recommend more time to spend in nature as a part of some kind of treatment?
Or maybe recommend. Could doctors recommend just go out in the nature? I think Gabi was already nodding her head that there is enough evidence on that. So what do others think? Do you think there's enough evidence? Kalle, you can say first. And we can.
Well, like I said, I think we have. Like, if you have no evidence that it is harmful, and I think we all think that it is in many ways it's good for your brains and your mood and so on. So I can recommend that. But if someone asks me a specific question that will I prevent celiac disease spending more time in nature, then I can say that we still need more evidence for that, and I don't want to give like a wrong kind of impression that we could prevent something specifically, but certainly I think we have enough evidence and experience that I can recommend that at the general level.
Next question, which is directed to Dr. Haveri. Hanna, regional authorities need to make priorities. So which exposome-based interventions do you think are cost-effective enough to be widely implemented in a Finnish well-being county?
Well, as I listened to Kalle, I fully agree. We need more research evidence if we want to make some healthcare recommendations, because we don't know all the particles in the cascades, and we should know that better if we want to have healthcare recommendations. And I also think that we can recommend nature to our patients, but I don't think that prescriptions are cost effective enough, because we don't have enough research evidence for that. But that's not a hinder to say to patients that go to nature. But I think the most cost-effective measures that we can do is in a community level or municipality level, and when we think about land use and all those structures that are surrounded by us, surrounded by our homes and ourselves, that's the most cost-effective measures that we can do in a society level. And when I think about, for example, city planning, we have to make sure that we have enough nature. Every inhabitant should have easy access to nature, so that it supports our mobility, it supports also our immunology. And when we think about children, it's not just the development of immunology, it's also the brain development, the brain plasticity. The more we have nature around us, we have less stressors, for example, and these are the factors we have to think about. What kind of things support our well-being and good development, especially in the childhood, but also when we grow up and we're adults or elderly people. If we think about, for example, city forests or city parks, they are also, in a wider scale, they are very important to inhibit, for example, heat island effects. And they are the coolers of the cities, and then we can also prevent people becoming more and more ill to heart and circulatory problems. And also there are indications that the more we have, for example, tree canopy coverage, then we have less mental health problems or diseases of heart and circulatory heart and circulatory system. We have also recent calculations in Finland have shown that if we take 10% of our green areas from the city, then we have 6% more mental health problems. And this is only mental health problems. So there comes other diseases as well that grow up when we take forests from the cities, or green areas from the cities. And also singular trees are important for our health, because they filtrate particles, especially if we think about quality of air we're breathing, then the singular trees may have also impact on our health.
Thank you. So yeah, land use very, very important. As a follow-up question, could you provide examples of return on investment for exposome-based interventions, such as upgrading indoor air quality compared to creating biodiversity-friendly yards? So,
if we think about these interventions, when it's always the most cost-effective if we save the original nature. Bringing the nature back is always more costly. Then if we have taken all away, then we can always bring back the nature, as the rewilding we have heard about today. And when we have more green structures around us, then we have also less, for example, small particles in our indoor air. And we have indications that, for example, ultra small particles can affect immunologic system, but it can, for example, go through blood-brain barrier system, at least in cellular level, cell line studies. And that is something that affects also our brain health, and, for example, can make us prone to memory diseases, degenerative diseases.
Thank you, Hanna.
Next question is mainly targeted for Ms. Vitikainen. Patient federations play an important role in shaping policy and being as a middleman between the patients and politicians. Where do allergy and asthma groups still feel that there is a gap in translating exposomic science into practical advice for everyday life?
Yes, well, in my answer, I will be speaking in a fairly general way about what is important from the perspective of a patient organization when applying research knowledge into practice. First of all, the message should be clear and targeted. And as for exposomic data, it of course already contains information specifically linked to the allergy and asthma community. Data such as what is important and why in prevention and mitigation of these diseases affecting them. When considering applicability to everyday life, clear instructions on what you can do and how to do it are always useful. For example, it can be difficult for families with children to find time in their daily lives. It would be useful to have specified knowledge of what kind of nature contact would be sufficient, in what kind of environment and for how long. As for targeting, it is important to demonstrate that the specific challenges of the allergy and asthma community are also understood. For example, in planning action recommendations, the limits set by possible symptoms must be taken into account. And from an organizational perspective, it is also important that our association activists have access to material that activates and engages members. I would also like to add that while HEDIMED provides information with a special focus in children and on the prevention of allergies and asthma, perhaps it would be that the message could be expanded to touch the entire life cycle, so that the message would be that the contact with beneficial microbes can alleviate the everyday life of those who already have allergies or asthma by supporting the function of immune system, which in turn may increase the tolerance for allergens.
Thanks. This was good reminders for us scientists that we should be clearer and more understandable and so on. The follow-up question, what type of messaging works best with these communities? Focusing on the risks or empowering them with the positive actions that they can take? Which strategy would be most beneficial?
Yes, well, empowerment is definitely the choice. The important message is that you can live a good life with allergies and asthma despite the challenges the diseases sometimes pose. Of course, you need to be aware of the risks and challenges, but the main focus is on providing ways to influence your own life. For example, it is important to know what kind of lifestyle choices you can make to support your health. And of course, the exposome knowledge underlines the importance of nature connection. One perspective on positive actions might also be that you can at the same time support your own health and the well-being of nature that enables it. Examples of this would include participating in nature conservation activities or greening the local environment.
Thank you. Okay, let's have a question for the next panelist, which is Professor Hentilä. We have heard already in this discussion that the built environment can either increase or reduce exposures. If exposomic evidence influenced building regulations, what zoning or housing standards would you change first?
Yes, first I have to say that zoning and housing standards are very, very contextual. So even within the European area, there are several statutory frameworks and guidelines and standards. So therefore, I think I answer on a more general level. And if I was the ruler, so the initial change should mandate increased access to green spaces near residential developments, and particularly in these areas where there are, vulnerable groups living. In the interdisciplinary strategic research consortium RECIPE, I have been leading. So the team consisting of representatives of different disciplines like environmental sciences and medical sciences, etc. So we have found out that accessible green spaces increase physical activity and mental well-being. So there are many cross-cutting well-being benefits, this kind of win-wins to find if we would have more green spaces near and also embedded to residential areas and developments. So I do agree very much with the fellow panelist Hanna Haveri, who also took this up.
Thank you. And as a follow-up question, can you share a design example that could help integrate exposomic evidence into urban planning and improve health outcomes?
Well, this kind of nature-based solutions could be good examples, like small planting areas or pots, or even this kind of small green pieces one could bring into city. Of course, it would be much better if there would really be contact to earth. So we wouldn't build underground garages, rather separate parking buildings if needed. So there would really be possibility to be in contact with the earth, and not only this kind of materials that have been brought to the building site.
Thank you. So, all right, next we have question for all.
Okay,
right?
So if we are looking 5 years out, which technological advances will most change or reform public health policy making? And we have a couple of examples like wearable sensors like rings or watches, maybe low-cost exposome chips like presented previously, or satellite-driven risk scores.
Oh, this is really a challenge, and I know that at the moment they try to regulate those kind of laws to have these sensors, for example, and implant them. In my eyes, it's more a back to the roots policy which we should have. I don't see technology spreading microbial biodiversity around. Although, I mean, we have probiotics, and probiotics maybe can really help. So the One Health probiotics and those for planetary health. I don't know if it is this kind of technology you mean, but this may help to go back to microbial diversity.
There could be different angles for the technologies. They can be analytics, or they can be something else.
Maybe in this time, then we would have everything enriched by probiotics of the next generation. Could be.
Yeah, well, on the computer science side, I think we have quite nicely all kinds of sensors already available. We are just not using them together. So I see that within 5 years, I think the biggest advance would be some sort of decision support tools, so for different users and especially the policymakers, so that we can make decisions based on the knowledge. So having information system which can bring together the environmental information from the satellites, maybe something which is collected directly on the cities with the sensors, and even with the crowdsourcing from the people themselves on the this kind of public level, but also different decision support tools for clinicians to investigate more options than the traditional medical options, that what's the problem on the patient. So having option to have an insight from the environmental factors, whether people are living or what kind of factors they are facing on their work life. So these kind of different decision support tools, so in practice softwares, which are bringing together the information from the environmental factors and, well, exposomic factors, if we are getting a bit wider scope.
Yeah, I think this is obviously very difficult question to predict. Technology, it always goes wrong, but like Juha said, I agree with that. I think we have now like entering in this new era where we have people are talking about digital twins and these kind of dynamic models where we combine a lot of personal data more and more like genomic data, omics data from individuals. And then we have these ways to monitor using these smartwatches and phones. And then we can combine these with AI, and we can really start to learn. At the same time, we can have like a population-based intervention, but also individual level targeted intervention. So this, I don't know whether it takes 5 years or more, but I think we are really entering this kind of era where we can have much more specific interventions. And as you mentioned, we can monitor the environment and give like specific recommendations. On the other hand, I also feel that we are really now entering in the new era of scientific research, because we can now use all these methods. And so far we have had like randomized controlled trials with a small group of individuals, and they are strong evidence, but they have many problems, as everyone knows. And for example, if we think about nutrition, it's really problematic because people have so individual responses, and we should have a really large cohorts. But now people are already conducting this kind of studies using smartphones and AI, that they can have like randomized like 20,000 person like the UK for this kind of nutritional studies. And that's really something completely different, because using our current ways to make scientific studies, it is very slow, and often even it can be even misleading if we have small studies and randomized small group of individuals, because all these exposomic factors, they are so heterogeneous, and they all have like genetic environmental interactions and so on. So a lot of things is happening. I don't think we will have only some single technical intervention. It will be, like Juha also said, that it will be a combination of many different things. And I think we all know that AI is the thing which is coming really fast, and this kind of deep learning and issues and so on.
Yes, I hope the sensors we probably have in the future, sensing the biodiversity of the living environments, could be something that sheds more light on the cascades that are happening in our bodies when we are exposed to biodiverse nature. But then I'm thinking about the quality of green areas. We have lacked good indexes or measurements. How can we evaluate the quality of green areas and how that affects human health? So maybe some kind of combination of them, probably developing indexes of biodiversity and combination to the big data, epidemiologic data on human health. Probably that's something that will be true in the near future, and we'll probably tell more about the environmental effects on human health.
Yes, I also think that indicators that combine human and nature's well-being are important. But if I think from the perspective of allergy and asthma community, then the technologies that enable the monitoring of environmental exposures are very important. For example, in the spring, it helps to anticipate the start of medication and the need for it. If there is information that there are many environmental exposures that affect symptoms. For example, in the spring when there is both odor pollen and street dust in the air.
Yes, thank you. So I have also rather high hopes on systemic cross-fertilization of large population-based health register data and geographic information systems, so GIS-based spatial data that could jointly inform urban planning and housing policies about the impacts of different building densities and also different types and qualities of green areas to human health. I think in this kind of dealing with this kind of large data sets, so machine learning approaches could or might be helpful in harnessing this kind of data, and then after that give recommendations for planners to refine their plans. But we all know there are some ethical issues to deal with and so on. So it's not straightforward path, but it's a promising path.
The next question is targeted to mainly for Juha. HEDIMED data platform tackles the privacy preserving integration. What are the best practices for public health agencies to access and utilize exposomic data while safeguarding individual privacy, in your opinion?
So easy question or not? Yeah. So as I say, the platform itself was developed as proof of concept, but more general use cases could be planned over similar approach. If you think about the public health agencies or health professionals, the primary use ruling, at least in Finland and also after EHDS is in force in Europe, it enables already quite well the access for them, so that they are not having actually problems to access many types of data, including the exposomic one, if there is available in those. So in a way, for the professionals, I don't see any problem. The only problem is that they should have some way to get that information on their own systems. The privacy side is not that big problem. But if we think about the research side, the question is different. So EHDS allows us to have this kind of access for health data. But as we have already seen, the exposomic data, very often it's not originally personal data. It's originally environmental data, which comes personal data when we get the personal information together with that, or we derive the piece from that environmental data as a personal side. Then it becomes personal data. And actually, that kind of personal data, which is needed to combine then the environmental factors to one single person, they are very personal because it means that where you are, who you are, like where you are living or where you are working. And in that way, I see that we need new systems. We need maybe even a new regulation to support this kind of data combination. So in HEDIMED project, we created satellite-based indicator maps from the region where we knew that all the people were. And then those maps were delivered for the cohort owners with small piece of software, which they could give the coordinate of the home of the person or work of the person. And then the script was generating these environmental factors from the living environment of the home or work, and that could be added to the personal information. But we don't have these kind of mechanisms on the secure processing environments yet. So they need new standards and they need new ways. I see that there won't be any way of bringing this personal information like coordinates of your home to some public environment. It must go other way around. You get the information into closed environment and then derive the indicators in that place. The same applies with any wearable devices. So you bring the data into the environment and there you create the indicators for the computer analysis. So I think the one thing to realize with the exposomic research is that there is multiple levels of research. So we need to create this kind of ground source of the data, like the sensor information, collect the cohorts, or we need to create these kind of environmental maps or environmental databases to collect the information. That's one side of research, one type of research which is needed. Then we need to have another research which is bringing all of these different pieces together in one platform or one environment, one view. And then on top of that view, we can do the analysis of different diseases, different health outcomes or preventive actions. As Kalle was mentioning earlier, exposomic topics, they may also prevent problems. So if we can promote good exposome, then it's another story. But altogether, we need to understand the little pieces and then bring them in one place and then use that bigger understanding that one health of one person as a source for and using multiple of those from different people to create this kind of population level exposomic understanding. So it's a multifold thing, and I think the key thing there is that we have environments and regulation in place which allows us to do that and enables us to do that. Currently, it's a bit challenging to bring all of this data together.
Then we have the next question.
Let's change the focus a bit, and this is mainly targeted to Tiina and Hanna, because one of you are representing patients and another one clinicians. So policies often struggle to ensure fairness to everybody. So how do we ensure that exposomic interventions, when they are ready, don't widen health gaps between socioeconomic groups.
From a general goal of a patient organization is that everyone must be guaranteed to have an access to a certain minimum level, and this means setting guidelines for minimum goals. And for example, early childhood education and basic education implemented in municipalities affect the majority of population. So in order to ensure equity, we might define the minimum level of an environmental quantity and quality that supports children's immune system, and also define how long and what kind of activities are carried out there.
Yeah, and then what about how doctors see the thing? I know that there have been a lot of discussion in Finland about this subject.
Well, I think we have to take a preventive angle to this. So we have to make sure that every inhabitant has access to a green area. That's a good way to promote health equally for everyone. But the interventions that has been presented here today as well, they present a good approach to this question. So when we bring green to, for example, kindergartens, that's very equal to everyone. But there are some kind of suggestions to urban planning. For example, if you have heard about the 330-300 rule, and that is a rule that recommends that every inhabitant in a city should see at least three trees from one's window, and tree canopy coverage should be at least 30% in the area, and also you should have the green area at maximum 300 meters distance from your home. And I would say that this is a good approach to equality in green areas and supporting health.
I could ask, because you are the clinicians, I'm just an engineering point of view. So like doctors are in Finland, they are in a way basing their own decisions on these käypähoito treatment options. And should we have like exposomic options for käypähoito then? So have enough this kind of clinical evidence that they work, and then try to make an alternative option for treatment as an exposomic go to the nature kind of option, or play with the dirt, or create your own field of flowers or something like that.
Well, as I mentioned, it's we have these kind of recommendations. They are not like forcing, but they should be considered when making decisions. And like I said, there's grading of evidence, and of course we need to have evidence-based medicine, but sometimes it is even problematic because we cannot make randomized trials about everything. I don't know what did you mention, that we should have like a separate current care guidelines for exposomic issues. I think at the moment we are already including them, like there at least there's some mention in the allergy guidelines that these could be helpful and so on. Maybe that's the way to proceed, that we are thinking like a disease first or disease group approach first. I don't know, can we make like a separate exposomic guidelines? Maybe if you think what Hanna was saying. I don't know, we have these planetary health recommendations, like Hanna probably knows them by heart, this by the Lancet committee, and so maybe something like that could be used in Finland.
Yes, at the moment that good practices guidelines, current practices are very disease specific, and as Kalle already told, we need very strong evidence, solid evidence to make recommendations to those. But there have been discussions about should there be some kind of general guideline for overall well-being. And then probably also these kinds of nature recommendations could be included, but these are just under discussion. But at the moment, the current care practices are directed to specific diseases.
Maybe then I ask a continuing question. This was about the treatment, but how about the testing these kind of environmental factors for the patients? So using some sort of omics tests or gut microbiome test to identify the problem. if there is something else than what normal tests won't tell you, should those be more used in Finland? I was just on stage and discussed with one, quite experimental clinician, but he was saying that he is very often using actually gut microbiome and other couple of specific omics tests when there is people who are not clear that what is the actual problem. So those can reveal more than the normal tests, what they are using. But as I am not a clinician, I have no idea how it goes in Finland.
That is something we are heading, but we really need more evidence. That's a little bit gray area, and we should be quite cautious because also in all European countries there are some kind of clinics which use this kind of, let's say, alternative tests. And it's a little bit gray area that we have evidence, but for example, looking at the microbiota, we all know that it is very complicated. And if you find there like a single changes in the microbiota or bacteria or like some yeast there, then it's tempting to start some kind of treatment. We should have answers when we make measurements. We should have answers. And for example, with microbiota, with omics, I think we are lacking answers in many times, and we have to be a little bit more cautious before we introduce this kind of things in the healthcare system. But it is tempting, of course, to use them at least for commercial purposes. But I would be quite cautious.
We will have the last question request for the panelists to summarize. What part of the exposome or the environment do you consider most important for their role in developing immune-mediated diseases? Are there factors that may be under-researched? Let's start with Helka-Liisa.
Yes, of course, there could be more research, but I would call for change in policies, like we should adopt a framework for shared urban health, one health in all policies approach, which could then mobilize researchers, policymakers, health professionals, urban planners, businesses, citizens, etc., to promote health in urban environments. So political action.
Thank you. Then Tiina.
I highlight the importance of a diverse environment. And I think we need still more specific information on, for example, how much nature exposure is needed for its effects to be long-term. A quick addition to this, I also would like to learn more on the importance of psychosocial factors.
Thank you. Then Hanna.
I will follow Helka-Liisa. I think urban planning is in the core of everything because we have to think about the healthy environments. How can we support them, and how can we support One Health as well?
Thank you. Kalle?
Yeah, I think it's obviously challenging question. I mean, viruses and diet, I think, are the most important thing. We have to think if you think what is easily modifiable environmental factor, exposomic factors, what they are. I think in theory it's environmental, like many people have been saying, but in practice I think it's very difficult. At this point of time, I would think that one thing we really have to consider is the diet, but we still need more evidence on that, and then when we learn more, we can talk about infectious agents also.
And Juha?
Well, it's a bit hard to answer this without any clinical expert, but based on all these varying discussions and data sources and whatever we have now faced on the platform, I would say that the big thing what is understudied is this common understanding over different fields of exposomic topics. So having the environmental, urban, personal exposome, and then these special exposomes and so on, having the view of all of those together and having this kind of common understanding how they affect to each other, that's definitely understudied and should be studied more. So having models to understand how they affect each other, that's my understanding.
Thank you. And then Gabriele?
Yes, for me the most important factor is the shrinking microbial diversity, which we have to consider for future developments and research as well.
Thank you very much, Gabriele. With this, we can close up the panel discussion sessions. I'm thinking Heikki may want to say a few words closing remarks soon, but before that, I want to sincerely thank the panelists for joining the panel and giving their important insights into the human health and exposome. So we all know that exposome research is important on human health. And then I give the floor to Heikki.
Well, maybe just a final few words. Also, my thanks, everyone. I think the day was actually quite exciting. When listening all the discussions, all the speakers today, having all this background information from HEDIMED, I think how I can say this, we are in the beginning of the exposome research now, so it's still a young baby, and it needs to grow a little bit before we can really be effective in the science in that field. But what we are doing here today, or what we are doing in HEDIMED, I think it's the key to the progress. And I mean that it needs to be quite multidisciplinary, because the exposome itself is very multidisciplinary and multi-dimensional. So that's, I think, it's a great value that we have people from different disciplines. We can combine this information. And also we have people representing different diseases. And that's, I think, has been one big virtue of HEDIMED, that we have learned from other diseases, and we are not in separate silos. I can see that this is developing very fast now, thinking about all these international efforts which are now starting, IHEN and the Moonshot Forum. I hope that we all can be proud of being part of this. So my thanks for everyone, especially also Jutta and Olli, for putting such a big effort for guiding us today.
Thank you, Heikki. So we also want to thank everybody. Also, Daniel Schmidtman from Empirica for helping us organize this event today. Yes, on behalf of our whole scientific management team here too, we want to thank you for participating in this event, and thank you very much, everyone.